So we started studying Zincum, yeah, and we're going to carry on studying Zincum. So, so when Socrates was poisoned with conium, so what he described was the ascending paralysis. So the top remedy for ascending paralysis in a Materia Medica is conium. And the top remedy for descending paralysis is Zincum. Okay? Come this side. It'll be easier. The other thing is, there are remedies in our Materia Medica which have direction of pains. Okay? So there are remedies which have ascending pains or descending pains. Then there are remedies like which have diagonal pains or complaints. Okay? If you have a linear pain which is in a line, the remedy is syphilium, the top remedy. Okay? What we find in Zincum are transverse pains. Always. They always go transversely, and it's kind of singular to that. One of the strongest characteristics of Zincum is the weakness, the exhaustion. Okay, and every time, if somebody's got weakness or exhaustion, let's say somebody in the family or one of your patients says, I have a lot of weakness and I have a lot of exhaustion. So obviously you take the symptoms and you prescribe them the indicated remedy. You try to understand what else are you going to prescribe. You tell them to eat better. Okay? You'll tell them to eat better. You'll tell them to eat at the right time. You'll tell them have better nutrition. Okay? And let's say, I have enough nutrition. I have a lot of food, but my weakness doesn't go away. So what's the next step? The next step is what you said, you give supplements. Okay? Now, when I'm saying you're covering the constitutional aspect of the remedy, you looked into circumstances, situations. Suppose somebody has, say, doesn't have a deep pathology, you've investigated them thoroughly, but is still complaining of weakness, which your constitutional remedy is not able to cover. And we are assuming that the choice of remedy is accurate. Okay? And you have advised better nutrition, and they also say we'll feel hungry, but somehow the strength is not coming, and then you give supplements, and still the weakness becomes worse after supplements. Then also the remedy is Zincum. Okay, so in spite of the best nutrition, in spite of the best supplementation, the weakness doesn't go away. Rather, the weakness gets worse. Then also, we think of prescribing Zincum. Okay? So, yes. Then it becomes an indication for Zincum. Okay? Okay? And you'll find that when you give Zincum, it'll bring about a change. Okay? So what will the change be in the form of? So when you prescribe to such patients Zincum Met, then what happens is they react with a lot of symptoms, or they react with some discharge coming in the body, or it will result in a lot of perspiration, or it will result in a form of a diarrhea, or maybe if somebody's, sorry, skin may break out, or they will come up with some expectoration, or they'll have increased urination, or they'll have increased bowel movement, and that will coincide with the general energy improvement. Okay, we'll start feeling better. So when you prescribe a remedy like Zincamet and there's a reaction in the form of a lot of symptoms or complaints or discharges of skin, what are you supposed to do? Stop repeating the remedy. You have to keep your hands off. Okay, so you have to remember our remedies don't cure, they only stimulate your vitality to cure. Okay, so Zincamet is useful in certain kinds of headaches. That's what we're going to study. So primarily Zincamet is useful in a headache which is there on the vertex. Okay, it's also an excellent remedy when there's headache, especially in the occiput. Okay, okay, it's an excellent remedy for that. And that headache is better by hard pressure, always. Okay, and that headache is also better, for instance, if they blow out some nose, some discharge comes out, that headache becomes better. So that any kind of a discharge, expectoration, maybe perspiration will get better. Okay, so Zincamet is indicated in several forms of headache. One of them is a stinging, tearing headache worse on the side of the head, greatly increased by wine. This headache is also worse after dinner. Sometimes you'll find Zincum indicated in obstinate pain in the head, yet intermittent in its quality, now very severe and now fading away, but continually recurring. It is also indicated for hypochondriasis and pressure on the top of the head, which is increased after dinner. You also find Zincamet indicated. So, do you know what is the remedy when headache is better after dinner? Chelidonium. That's the remedy. Okay. So, chelidonium has the symptom all complaints better after dinner. Okay. You'll also find Zincamet indicated in hydrocephaloid. The child rolls its head. It awakens from sleep as if frightened, looks around the room terrified. This is also found in stramonium. They wake up frightened, okay, terrified of everything that they see or the first thing that they see. The occiput is apt to be hot and the forehead rather cool. There is grinding of the teeth. The eyes are sensitive to the light and are fixed and staring. The face is sunken and pale, or alternately red and pale. The nose is dry. There's jerking of muscles during sleep. And of course, there's constant fidgetiness of feet and legs. So, both legs and feet are generally fidgety. So when it comes to spine, so you have to remember, whenever it's an excellent remedy for pain, especially in the nape of neck. The patient will always point out the suboccipital region, the pain in the nape of neck, which is worse from constant sitting or desk jobs. And there's a tired feeling. It's also an excellent remedy for backache. Okay, backache, which is especially in the lower back. Okay, and it is worse while sitting. Okay, so this is also found in cobalt, worse by sitting. Okay, and both are excellent remedies for complaints from sexual excesses, especially backache, which comes from that. But Zincum is better by the seminal emission or any discharge. Cobalt is not affected by that, rather gets worse. Okay, the other most important thing is a burning which is felt in the spine. Okay, which is found in many remedies, so it's just a subjective symptom. Okay, remember Zincum, Ignatia, and Agaricus. These are the top three remedies in the Materia Medica for twitchings. Okay, Zincum, Agaricus, and Ignatia. They are the top three remedies for twitchings. Okay. And like Rustox, the backache of Zincum is also better by walking. Okay, but the difference is that the pain is better by walking, the patient is exhausted, whereas Rustox will improve in general after walking. Okay, so even the exhaustion gets better when walking. We also find under Zincum trembling of the limbs with the feeling as if they were about to be paralyzed, sudden spasmodic bursting sensation about the heart. Now, what is the contradiction out here? It is a spasmodic bursting sensation. So they are actually opposite sensation. A spasm which is more constrictive, and then there's a bursting sensation. The heartbeat is irregular, and it sometimes suddenly seems as if it would burst through the chest, constriction of the chest causing shortness of breath. The pulse is slow or weak and irregular, weakness and goneness in the stomach at 11 a.m., which is also found in phosphorus, natrum phos, sulfur, asafoetida, hydrastis, and indium. Zincumet is useful in the affections of the eye. For instance, amblyopia accompanied by severe headache. And so, what happens is, remember, one of the important spheres of action of Zincumet is the orbit. The entire orbit is strongly affected by that, and especially the root of the nose. Okay. And then you find the most intense pain, especially on the inner canthus of the eye, especially on the inner canthus. Okay, and they're generally sharp pains. Zincumet has marked gastric and hepatic symptoms. It produces a bitter taste, which is referred by the patient to the fauces. As soon as a spoonful of water reaches the stomach, it is ejected. Heartburn is present, and this is increased by wine and also during pregnancy. So, why do you think that Zincumet, like for instance, heartburn and all, will be worse during pregnancy? No, because there is no menstrual flux. The discharges are absent. So the symptoms get worse. It is accompanied by varicose veins of the legs. There's a feeling as of a hard tumor in the neighborhood of the umbilicus, and this is accompanied by griping pains. It produces griping pains about the navel with most obstinate constipation, accompanied by a great deal of pressure backwards, as though the abdomen were being drawn back towards the spine. The urine often contains blood. So, how does Zincumet pass urine better? By leaning backwards. It also passes urine better when they cross the leg. Okay, when they cross the legs, they are able to pass better, and the hematuria occurs after urination. All in all, you have to remember, as I explained in the last class also, whenever you find patients with neurological complaints, a lot of times the symptoms of Zincumet seem to be there. It seems to be indicated. But remember, they are then common symptoms of the disease. So your prescription always has to be on symptoms which are uncommon to the pathology. Okay? So it cannot be a regular prescription for neurological conditions. Okay? You have to keep that in mind. Okay? So I've seen many doctors who will prescribe Zincumet, for instance, for restless leg syndrome. Now, that's not the right way of prescribing just because there's restlessness and there are sharp pains. It is not enough of a reason. It can't be a remedy for all the people. Like agaricus is often seen in regular prescriptions for people who've got a hemifacial spasm or they've got some other twitchings of some kind or the other. But remember, that cannot be a reason to prescribe agaricus. Okay? When you find that twitching more as a concomitant unrelated to the disease, then it becomes a symptom worth prescribing. Okay? So please remember that what's more important is striking, singular, uncommon, peculiar, aphorism 153. Okay? And if you will keep that in mind, then you'll be able to prescribe Zincum med way better. Okay. Another main modality of Zincum med. So, how is Zincum med patient better? Better by discharges. Okay. What else makes it better? Heart pressure makes it better. Excellent. The other thing which also makes it better is when they are in warm open air. So when the open air is warm, then also they feel better. Okay. Now this better being warm open air is kind of singular to Zincum med. You do not find that often. Okay, we all know better in open air. Okay, but out there people are looking for cool, cool. Okay, if not cold, it's cool at least or pleasant at least. But Zincum med, on the other hand, is better by warm open air. That makes it better. Okay. So keep this in mind. A remedy of limited use, but extremely useful and cannot be replaced when required. Okay. So in the next class, we'll take up the next remedy. Okay. मैम आप कोई केस शेयर करेंगे जिंकम मेट वाला?
Sir, I have not used it very frequently in my
जी
training, but
जी
one of the case of a teacher, chemistry teacher in some Medica school, she used to come, she's coming for many years, always complaining of heaviness of the head. Always my head is heavy, and I feel congested eyes, as if I am unable to open for teaching and all that. And frequent episodes of sinusitis. Then her main complaint was, give me something so that I can sneeze, my head will, I will feel light. And after this, once my headache is so severe, I feel very exhausted, unable to even teach to the students, come back to the home and sleep. These were, and I tried many medicines to improve little little. That in that case, because suppressed discharge, keeping in mind and headache, I gave Zincum Metallicum 200 molecules. And after 3 days, she called me and said, I had 2-3 sneezings. I am feeling much better. What should I do? Should I continue? मैंने कहा वो तो ऐसे बाद में continue the medicine. That was the medicine acted. And slowly I used to give Zincum Metallicum 200 weekly dose for 3-4 weeks, and she felt much better. Her main complaint was heavy head. Always the head was heavy. So this is the case where I saw the result better after sneezing. This was
yeah. So on the in the repertory of BBCR, okay, you can look in the same website homeoint.org. If you open BBCR, open the general chapter on modalities, which is the last one that you'll find. अनुभव इसको रखो 2 मिनट. Okay, look at that rubric in BBCR. Sneezing ameliorates. Can you see that? Rahul, are you there? Yeah? Have you seen that? It's slow to load. You have an obstacle to network out here. Mila bacha, Aditi, did you find what are the remedies there? Yeah. So one of the best remedies that you have for better after sneezing, one of the best from the Materia Medica is Thuja. Okay. So
One of the best remedies
Thuja, out of all of these, better after sneezing. One of the better remedies, ma'am, that we have. Well, I'm just sharing with you because not a lot of people will come and tell you. See, if somebody's got a stuffy nose, okay, or a blocked nose, and they tell you, I'm better by sneezing, okay, so what would you say? Is that common or uncommon? It's a common symptom. It's a common symptom, but no, no, ma'am, not related to your case. But what I'm saying is, but if somebody says every time I have a blocked nose, I need to sneeze to become better, then it becomes a striking symptom. Are we together? Yeah. The same, see, some symptom becoming striking or intense may not always be an uncommon to the pathophysiology, but by the persistence, it can become an important symptom for prescribing. Okay. So remember, what are the remedies again? Ammonium carb, chloralum also. Chloralum also. Okay, you have to remember these 6 remedies. Okay, lycosis also.
put some empty and all that, na, so
To
that
trigger sneezing, yes.
trigger, but
So
never.
I'm just telling you, मैम मतलब generally देखो मैम आपका तो I'm sure और भी बहुत सारे features होंगे केस में, but generally I want you to keep these remedies in mind. They are excellent remedies. It's a modality which is less thought of, but it's an excellent modality, especially when it is unrelated to the disease. Okay, so I remember a long time back, there was a patient of mine who complained of a lot of hardness of hearing, and he had lost his hearing also, and it's old patient. But he said, and he used to carry around, ma'am, like ma'am was saying, a handkerchief, and he used to tickle a sneeze, and he said every time he would sneeze, he would hear better for a few minutes. And Thuja brought about a remarkable change in him and improved his hearing. And it's one of the symptoms which come up very strongly improving. The best part about BBCR is that BBCR has no clinical symptom. It has purely proving symptoms, and symptoms which were verified by cures after they were found in provings. The Ken's repertory has a lot of clinical symptoms. This book has no clinical symptom. So extremely reliable. Okay. So keep that.
Sometimes it happens that maybe because of the lack of knowledge, broad knowledge of that particular medicines, we are unable to catch the general symptoms and give on basis of that and the patient improves.
Totally.
The medicine
Totally. I totally agree, ma'am. I totally agree. So keep this in mind, okay, and have a fabulous rest of the Sunday. Okay. Ciao. Thank you. Thank you.